Hey guys, my name is Derek Calico, and today we're going to be discussing one of the biggest spinal deformities in the world, scoliosis. In this presentation, we're going to be looking at the symptoms, treatments, some stats and facts on scoliosis, and a whole bunch of other things. Hopefully, you can take some information from this presentation and put it to good use in your future careers. Let's get started.
So let's first dive into what scoliosis is. Scoliosis is an unnatural sideways curvature of the spine. In most cases, the spine will curve in a C or S-like fashion. If you look at the picture to the right, the spine is curved in a C fashion, which is much more common than the S. Most severe cases are what the S spine curves into. Most scoliosis cases can be linked to other diseases or most diseases can be linked to scoliosis, but the true underlying cause of scoliosis is relatively unknown. Some symptoms of scoliosis can include back pain, uneven hips, rotated spine, improper shoulder blade placement, and some problems breathing. A lot of these symptoms are due to the fact that the body is trying to compensate for this abnormality in the spine. And with this compensation comes some other problems in the body. Some facts about scoliosis. Early diagnosis is critical for treatment and recovery. The earlier you can diagnose it, the easier the treatment and recovery is going to be. Again, most cases of scoliosis have no causation or reason why it occurs. Roughly a small percentage of people, about 30%, need immediate treatment if diagnosed with scoliosis. Again, that goes back to how early was the diagnosis of the scoliosis. Another interesting fact, scoliosis is actually hereditary and can sometimes go unnoticed. If the disease is so mild that there's just a slight bend in the spine, you could not even notice it, and it could actually fix itself on its own through simple aging process. So something to look into in family or medical history. A few statistics about scoliosis. Spinal deformity in general accounts for over 857,000 healthcare visits every year in children and adolescents. Average cost of a hospital stay for a child with scoliosis is roughly $92,000. Adults with scoliosis are twice as likely to require long-term care compared to children, mainly because if it's found in children, usually that's an early diagnosis, which means it can be remedied pretty quick with, again, wearing a brace and the physical therapy. Most of the time, if it's diagnosed in adults, you've had it for a long period of time and it requires a bit more work. Also, 74,000 emergency room visits are made each year by adults with scoliosis. And so for our first activity, fun little activity, just find 3 celebrity or famous individuals that have been diagnosed with some form of scoliosis. This could be some severe cases, it could be very mild cases, just any 3 famous celebrities that have been diagnosed with some form of scoliosis. List the 3 individuals and just describe briefly what they do today. Make sure to answer this in the discussion forum on Pilot. Treatment of scoliosis occurs in one of 2 ways, surgically or using a brace. Most cases require just wearing a brace and having to go to physical therapy a couple times a week. It's a lot more common than surgery. If it's diagnosed early enough, this is the best route to go. Surgery comes if the disease is well developed and hasn't been diagnosed until later on down the road. It's not an end-all be-all cure. What it does is it basically prevents the spine from twisting any more than it already has. In some cases, it'll prevent the scoliosis from getting worse, but after that, there's no real true cure for it. After the surgery, most of the time, it is recommended to wear a brace and then go to therapy, like in step 1, but it's not a true fix. Mobility is probably one of the biggest challenges facing people with scoliosis. They tend to have more than just back problems due to the fact that since there's a spinal abnormality, the body is going to try to compensate for that deformity, and it's going to do it in ways that will lead to other issues. Most people have a loss of natural posture and may even form kyphosis, which is actually the rounding of the upper back, or what some people call hunchback. Changes in hip level, uneven shoulder blades, and overall gait changes can cause restriction in basic movements such as bending, standing, walking. Some severe cases, people have to be placed in a wheelchair because they cannot move properly or be expected to walk on their own due to the severity of scoliosis. In other cases, you don't even know they have scoliosis. That's how mild of a case it is. So it's on a case-by-case basis. Cognitively, when one suffers from scoliosis, mental health can range from great to poor, depending on the environment and the support system that they receive from treatment and family. Scoliosis has not been linked to any sort of intentional mental diseases or poor mental health. However, mental health can be greatly influenced in a multitude of ways. Depression and anxiety are probably the two biggest worries with people with scoliosis, especially those with severe cases. Um, they understand that people view them differently because of the abnormalities that they have, and that plays a big factor in their mental health. Um, Again, if it's treated early enough and treated properly, um, the cases won't be as severe and mental health will be as if they never had a disease. Again, it's on a case-by-case basis. Some people, even if they have severe scoliosis, never fall into a depression or have anxiety. It depends on the person and the type of people that they have supporting them throughout the process. Behaviors in people with scoliosis, just like mental health, can vary in people who have been diagnosed. Scoliosis is considered a multi-system disease because it can affect a multitude of systems in the body. In those who have been affected, the severity of the disease can lead to the different types of behaviors that they exhibit. Most severe cases cause people to be sheltered from their environment, sheltered from the people they love, take on, again, the deep depression that could come about. And then they don't want to partake in their daily lifestyles due to the fact they have scoliosis. Most cases, however, people have a mild case of scoliosis and they go on to lead normal, healthy lives with no such abnormalities in behavior or wanting to do things opposite of what they usually would do. Again, the behavior change is more common in more severe cases rather than mild cases. When considering people with scoliosis, again, you want to try to diagnose the issue as early as possible. The earlier you diagnose it, the better off it's going to be. If it's diagnosed later on down the road, surgery is probably going to be required to help fix the injury. When it comes to therapy, you don't want so much strength training as you want flexibility. You want to get the muscles relaxed, you want to get them flexible. By strengthening the muscles, you're actually going to put more pressure on the spine, which in turn is going to hurt the process of recovery of scoliosis. Flexibility in the hips is very important, as it could sometimes be out of line due to the unnatural curvature. If you want to work on strength, core is very vital. The stronger core you have is going to take away the tension and the added stresses on your lower and upper back. So for strength training, core is very key. But otherwise, flexibility is probably the number one thing in the upper back and the lower back for scoliosis patients. And for the final activity, I want you to put yourself in the position of a physical therapist. Your patient walks in and he is a 12-year-old boy who has been diagnosed with early stages of scoliosis. You do not notice it when seeing him, but he does have a little bit of a limp. I want you to come up with a few exercises, roughly 2 or 3, that you could add into a program that would benefit him and aid him his recovery long term. Think of the flexibility, think of core strength, think of how the hips would be acting, shoulders. Think of all this stuff when you're trying to think of these exercises. When you think of them, type in the discussion forum along with the first activity. And here are my references. I hope you guys enjoyed the video. Hopefully you learned something from this, and hopefully that you can take the information that you've learned from this video and put it to good use in your future careers. Appreciate it. Have a good one, guys.